You wake up at 3 in the morning again. You walk to the bathroom in the dark, half asleep, and you blame your bladder. But your bladder may not be the real problem. If this has been happening 2, 3, even 4 times a night, stop and really think about it for a second. Not just once, not twice for the whole night, 2 or more separate times every night for weeks. That pattern has a name. Doctors call it nocturia. Nocturia simply means waking up over and over during the night to urinate. And while it feels like a bladder issue, in a large number of older adults, the bladder is only the messenger. Something else inside the body is sending the signal, and the bladder is just where that signal shows up. Before we go further, if you want health information explained in plain language, without panic and without sugarcoating, subscribe to Dr. Michael Carter and tap like. This channel is built for adults over 50 who want to understand what is actually happening inside their bodies. And before we continue, write your city or country in the comments. It helps us understand where this message is reaching. Now let's talk about why this happens, because the explanation most people believe is usually incomplete. Most people assume nighttime bathroom trips are simply a normal part of getting older, or a weak bladder, or drinking water too late. Sometimes that is part of it. But clinical research shows nocturia becomes extremely common with age, affecting roughly half of adults over 60 and up to 80% of adults over 80. That is not a small side effect of aging. That is a signal worth paying attention to. Here is the reversal. In many older adults, the kidneys are not producing more urine because something is wrong with the kidneys themselves. They are producing more urine at night because of what is happening somewhere else in the body during the day, and what changes the moment you lie down. Let's start with gravity, because this is the piece almost nobody explains clearly. During the day, if you are sitting or standing for long periods, fluid can slowly settle into the lower legs. This is especially common if you have any degree of vein weakness, called venous insufficiency, or if your heart is working harder than it used to. That fluid pools around the ankles. You might even notice it as mild puffiness by the end of the day, shoes feeling tighter, socks leaving a deeper mark on the skin. Here is what most people never connect. When you lie flat at night, that fluid does not just disappear. Gravity is no longer pulling it downward, so it slowly moves back into your bloodstream. Your kidneys detect that extra fluid volume circulating, and they respond the way they are designed to respond. They filter it out. That means more urine production, specifically at night while you are trying to sleep. This is called nocturnal polyuria, meaning the kidneys are producing a disproportionately large share of the day's urine during nighttime hours. This is where the story usually gets more serious, so listen carefully and remember, this is medical education, not a diagnosis. Research has connected nighttime fluid redistribution and nocturnal polyuria with several underlying conditions that deserve real attention. Congestive heart failure is one of them. When the heart is not pumping efficiently, fluid can back up in the body, especially in the legs, during the day. At night, that fluid mobilizes. The body releases a hormone called atrial natriuretic peptide, and the kidneys respond by producing more urine. Multiple medical reviews describe nocturia as one of the early, under-recognized signals connected with heart strain, sometimes appearing before more dramatic symptoms like shortness of breath ever show up. Obstructive sleep apnea is another major piece of this puzzle, and it is one of the most overlooked. When breathing is repeatedly interrupted during sleep, pressure changes occur inside the chest. Research indicates this can trigger the release of that same hormone, atrial natriuretic peptide, prompting the kidneys to produce more urine overnight. In plain language, the airway problem is not just about snoring or tiredness. It may be quietly pushing your bladder to fill faster while you sleep. Some sleep researchers now describe nocturia as a symptom that can predict undiagnosed sleep apnea, especially when it appears alongside loud snoring, morning headaches, or daytime exhaustion that never fully goes away. Then there is blood sugar. When glucose levels run high, especially in poorly controlled type 2 diabetes, the kidneys try to clear the excess sugar by pulling more water into the urine. This is called osmotic polyuria. It does not just happen at night, it happens around the clock, but it often becomes most noticeable at night because that is when the disruption to sleep is impossible to ignore. If nighttime urination is happening alongside increased thirst, unexplained fatigue, or unexplained weight change, that combination deserves a conversation with a doctor and a simple blood test. There is also a hormone most people have never heard of, called antidiuretic hormone, or vasopressin. Normally, your body increases the release of this hormone at night, which concentrates your urine and reduces how much you need to produce while you sleep. This is one of the reasons younger adults can sleep through the night without waking. But this natural nighttime surge weakens with age. Thoughtful. When it weakens or disappears, the kidneys stop conserving water properly during sleep, urine output increases, and the bladder fills faster, even if nothing else in the body has changed. This alone explains why nocturia becomes so much more common after 50 and even more common after 70. And then there are the everyday habits that quietly make all of this worse. Evening fluid intake, especially large amounts within a few hours of bedtime, caffeine in the afternoon or evening, which has a mild diuretic effect, alcohol, which suppresses that same antidiuretic hormone we just talked about, meaning it directly increases nighttime urine production, not just bladder irritation. Informative high salt intake during the day, which increases fluid retention and later fluid mobilization at night, and the timing of certain medications, especially diuretics, sometimes called water pills, which are frequently prescribed for blood pressure or heart conditions. If a diuretic is taken late in the day, its effect can land directly in the middle of the night. There is one more mechanism worth understanding because it explains why this becomes so much more common specifically after 60 and 70, even in people who have no heart condition, no diabetes, and no sleep apnea at all. As kidneys age, their ability to concentrate urine gradually declines. In younger adults, the kidneys can take a smaller volume of fluid and pack more waste into it overnight, which means less total urine volume while you sleep. Older kidneys lose some of that concentrating ability. The result is a larger volume of more dilute urine produced at night, even when fluid intake has not changed at all. This is simply a physical, age-related shift in kidney function, and by itself it is not dangerous, but combined with any of the other factors we just discussed, heart strain, sleep apnea, elevated blood sugar, or medication timing, this age-related change can turn an occasional nighttime trip into a nightly disruption. Thoughtful. This pattern also matters for reasons that go beyond sleep quality alone. Research following older adults over time has connected frequent nighttime urination with an increased risk of falls, and this makes intuitive sense once you think about it. Walking through a dark hallway, half asleep, disoriented, often without turning on a light, is one of the highest risk moments in an older adult's entire day. Some studies have also linked persistent nocturia with reduced next-day alertness, lower mood, and in some populations, a measurable association with frailty over time. None of this means nighttime urination causes these outcomes directly. It means the disrupted sleep and the underlying mechanisms driving it can contribute to a broader pattern of declining resilience, which is exactly why this symptom deserves more attention than it typically receives. Concerned. Let's walk through a realistic example, because abstract mechanisms are easier to understand with a real scenario attached to them. Picture a 68-year-old man who has noticed over the last 4 or 5 months that he is waking up 2, sometimes 3 times a night. He assumed it was simply his prostate, or simply his age. He also mentioned, almost as an afterthought, that his ankles have looked a little puffier by dinner time, and that his wife has commented on his snoring getting louder over the past year. Individually, none of these facts seemed connected to him. But together, they describe a pattern that points toward possible fluid redistribution and possibly undiagnosed sleep apnea, both of which are common, both of which are manageable once identified, and neither of which he would have mentioned to his doctor if he had not learned to notice the pattern as a whole instead of dismissing each piece on its own. This is not about turning ordinary aging into a source of fear. It is about learning to describe what your body is doing with enough precision that a doctor can actually help you. Most people describe symptoms vaguely. I don't sleep well anymore. A vague description leads to a vague response. A specific description leads to a specific answer. This is not about panic. This is about pattern recognition, and pattern recognition is something your doctor cannot do for you unless you actually notice the pattern first. Before we go to the next part, tap like if this explanation is making the pattern clearer for you. It helps this video reach more older adults who may be dismissing the exact same signal as simply getting older. Now let's talk about what you can actually observe, because this is where the video becomes practical. First, look at your legs at the end of the day, before bed. Press your thumb gently into the skin just above your ankle bone and hold it for about 10 seconds. If a visible dent remains in the skin afterward, that is called pitting edema. It does not mean you have heart disease. It does not mean anything is failing right now. But it is a physical sign of fluid accumulation, and it is worth mentioning to your doctor, especially if it is a new change, or if it is getting worse over weeks. Second, pay attention to timing. Waking once occasionally, especially after unusually high fluid intake in the evening, is common and usually not concerning. Waking 2 or more times almost every night, consistently, for several weeks, is the pattern at matters clinically. Doctors sometimes call 2 or more nightly episodes bothersome nocturia because at that frequency, sleep quality and daytime function are measurably affected. Third, notice what happens around it. Are you also more tired during the day than you used to be? Do you snore loudly, or has a partner mentioned that your breathing seems to pause during sleep? Have you noticed increased thirst or unplanned weight changes? Are your ankles or lower legs more swollen than they used to be by the evening? None of these individually confirm anything, but together they form a pattern, and that pattern is exactly what a physician needs to properly evaluate what is going on. Fourth, think about your medication timing, especially if you take a diuretic or blood pressure medication. Do not stop or change any medication on your own. That decision belongs to your doctor. But it is completely reasonable to ask your doctor whether the timing of a medication could be contributing to nighttime urination and whether an adjustment might help. If you have noticed this pattern in your own life, write one word in the comments: yes, not your priva, to medical details. Just yes, thoughtful. It helps us understand how many people are quietly dealing with this and never talking about it. Avoiding diary is one of the simplest tools here, and you do not need anything fancy to keep one. For 3 or 4 days, write down the time of each bathroom trip, roughly how much fluid you drank and when, and whether you woke specifically because you needed to urinate, or whether you woke for another reason and simply used the bathroom while you were up. That last distinction matters more than people realize. Doctors sometimes call this second pattern a convenience void, and it is treated differently than true nocturia, where the urge to urinate is what actually interrupts your sleep in the first place. A few days of honest notes, even written on paper by your bed, can turn a vague complaint into genuinely useful clinical information. It also helps to notice whether the pattern is stable or changing. Some degree of nighttime urination that has been present, unchanged for years, is a very different clinical picture than a pattern that has clearly worsened over the last few months. Curious. A steady, gradual pattern is often more consistent with the age-related kidney changes we discussed earlier. A pattern that is clearly getting worse, especially alongside new swelling, new breathlessness, or new fatigue, deserves a more urgent conversation with your doctor, not because it is automatically dangerous, but because change itself is the signal worth investigating. Now, here are the situations where this stops being something to simply observe and becomes something that needs medical attention without delay. If nighttime urination suddenly appears along with chest pain, pressure, or tightness, seek emergency care immediately. If it comes with sudden shortness of breath, especially when lying flat, or if you find yourself needing to prop yourself up on pillows just to breathe comfortably, that is not something to wait on. If you notice sudden, significant swelling in one leg only, especially with pain, redness, or warmth, that requires prompt medical evaluation because it can reflect a circulation issue that needs immediate attention. If nighttime urination appears along with blood in the urine, fever, severe lower back pain, confusion, sudden weakness, or fainting, do not wait. Seek medical evaluation right away. These are not the everyday version of this pattern. These are red flags, and red flags always come first before any explanation of mechanism, because your safety matters more than understanding this. Science behind it. For everyone else, the everyday version of this story, here is the honest, non-dramatic truth. Nocturia is common. It is treatable in many cases, and in most situations, it is not a sign of imminent danger, but it is also not something to simply accept as just getting older without ever asking why. Clinical data shows this pattern repeatedly. The body rarely changes without a reason, and nighttime urination is very often the body's way of showing you something that has been building quietly during the day. This does not diagnose disease by itself. This video cannot and should not replace an actual evaluation from your doctor, but it can help you walk into that appointment prepared with specific observations instead of a vague complaint. Encouraging. Instead of simply saying, "I keep waking up to pee," you can now say, "I'm waking up 2 to 3 times a night. I've noticed some ankle swelling by evening, and I take my water pill in the afternoon." That single sentence gives your doctor far more useful information than most patients ever provide, and it dramatically increases the chance of an efficient, accurate evaluation. When patients report this pattern to doctors, the common evaluation often includes a review of current medications and their timing, blood tests to check kidney function, blood sugar, and electrolytes, a physical exam checking for swelling in the legs, and sometimes a simple voiding diary, where you track fluid intake and urination times for a few days. In some cases, if sleep apnea is suspected based on snoring, pauses in breathing, or persistent daytime exhaustion, a sleep study may be recommended. None of this is complicated. None of this is invasive. It is simply the process of finding the actual mechanism behind the symptom, instead of assuming it is just age. There are also simple, doctor-approved habits that can genuinely help without replacing medical care. Reducing fluid intake in the 2 to 3 hours before bed, while still drinking enough throughout the day, especially earlier. Reducing evening caffeine and alcohol, since both interfere with the body's natural nighttime fluid regulation. Elevating your legs for 20 to 30 minutes in the late afternoon if you notice ankle swelling, which can help your body process that fluid before bedtime instead of overnight. Reducing salt intake, since high sodium increases fluid retention throughout the body. And talking to your doctor about medication timing, particularly diuretics, rather than adjusting the dose or timing on your own. Thoughtful. None of these habits are a guarantee, none of them are a cure, but research suggests they can meaningfully reduce nighttime urination frequency for many people, especially when the underlying cause involves fluid distribution rather than a more significant medical condition. Compression stockings are another option some doctors recommend during the day, specifically for people who spend long hours sitting or standing and who notice ankle swelling by evening. By gently supporting the veins in the legs, they can reduce how much fluid pools downward in the first place, which means there is less fluid to mobilize once you lie down at night. This is not something to start without talking to your doctor first, especially if you have any circulation conditions. But for the right person, it is a simple, low-risk habit that directly targets one of the mechanisms we walked through earlier. Let's bring this back to where we started. You wake up at 3 in the morning again, and you assume it is just your bladder, just your age, just something to live with. But now you understand what is actually happening underneath that moment. Fluid that moved during the day is moving again, in at night. A hormone that used to concentrate your urine while you slept is not working the way it once did. And in some cases, a heart, a set of lungs, or a metabolic system that is quietly asking for attention is using your bladder as the only way it knows how to get your attention. Surprised. That is the real reversal here. The symptom is visible. The underlying cause is very often hidden. Small sign, large mechanism. The body changed, but the explanation most people were given never changed with it. You do not need to panic about this, but you also should not dismiss it. If this is a pattern you recognize in your own life, or in the life of someone you love, the next step is simple. Mention it to your doctor, specifically, clearly, and with the observations we just walked through together. If this helped you understand your body more clearly, subscribe to Dr. Michael Carter, tap like, and write your city in the comments. Your comments genuinely help shape the next videos we create, and they help us understand which patterns are affecting the most people watching this channel. This video is for educational purposes only and is not medical advice. Always talk to your doctor before changing any medication, supplement, diet, or exercise routine, and before making any decisions based on what you learned here today. Take this information, bring it to your next appointment, and use it to ask better questions. Thoughtful. That is exactly what this channel is here for, and it is exactly why understanding the mechanism behind a symptom matters just as much as noticing the symptom itself.